As asthma, a common chronic respiratory condition. I'll provide you with the key information using mnemonics, simplified explanations, and memory aids to help you understand and remember this topic effectively. Understanding the pathophysiology of asthma. 1. Key concept. Chronic inflammatory disorder of the airways leading to reversible airflow obstruction, bronchial hyperresponsiveness, and airway remodeling. 2. Simplified explanation. Think of asthma as sensitive airways. 2. The airways become inflamed and easily constricted, narrowed, making it hard to breathe. 3. Mnemonic AIR for key aspects of asthma, airway inflammation, chronic, increased hyperresponsiveness, reversible airflow obstruction. 4. Key features. Airway inflammation, chronic inflammation of the bronchial tubes involving immune cells, inflammatory mediators, and cytokines. Bronchial hyperresponsiveness, increased sensitivity of the airways to various triggers, causing exaggerated bronchoconstriction, narrowing. Airway obstruction, reversible narrowing of the airways due to smooth muscle contraction, edema, swelling, and mucus production. Airway remodeling, structural changes in the airway walls, for example, thickening of the basement membrane, smooth muscle hypertrophy, and mucus gland hyperplasia due to chronic inflammation. 5. Main triggers: allergens, pollen, dust mites, pet dander, mold. Irritants: smoke, air pollution, strong odors, cleaning products. Respiratory infections, viral infections, for example, colds, flu. Exercise, especially in cold or dry air. Cold air, inhalation of cold air. Emotions, stress, anxiety, excitement. Medications, certain medications, for example, NSAIDs, beta blockers. Occupational exposures, chemicals, dusts. 2. Clinical manifestations of asthma. 1. Key idea. Symptoms vary in severity and frequency and are typically episodic. 2. Mnemonic for asthma symptoms. Wheeze. Wheezing, a high-pitched whistling sound during breathing, especially expiration. Heavy breathing and feeling of not getting enough air. Excessive coughing, often at night or in the early morning. Expiratory difficulty with prolonged exhalation. Zealous shortness of breath, dyspnea, and chest tightness. Exacerbations, flare-ups may be triggered by allergens, irritants, and infections. 3. Specific symptoms. Wheezing, a hallmark symptom, often more pronounced during exhalation. Cough, can be dry or productive, often worse at night. Dyspnea, difficulty breathing or shortness of breath. Chest tightness, a feeling of pressure or constriction in the chest. Increased respiratory rate, rapid breathing during an attack. Use of accessory muscles. Use of neck and shoulder muscles to assist breathing during an attack. Symptoms worse at night, often referred to as nocturnal asthma. 3. Diagnosis of asthma. 1 key idea. Diagnosis is based on clinical history, physical examination, and pulmonary function tests. 2. Mnemonic for diagnosis, HAP. History, a detailed clinical history including symptoms, triggers, and family history. Auscultation of the lungs, to listen for wheezing and decreased breath sounds. Pulmonary function tests, PFTs, such as spirometry, measures airflow rates, particularly the forced expiratory volume in 1 second, FEV1, which is reduced in asthma. Bronchodilator reversibility test. Increase in FEV1 of 12% or more after bronchodilator administration. Peak expiratory flow, PF. Reduced peak flow in those with asthma. 3. Additional tests. Methacholine challenge, test, airway hyperresponsiveness test. Allergy testing. Skin or blood tests to identify specific allergens. Chest X-ray, usually normal in asthma unless another condition is present, such as pneumonia. Fractional exhaled nitric oxide, FeNO test, measures inflammation in the airways. IV. Management of asthma. 1. Key idea. Management aims to control symptoms, reduce exacerbations, and minimize airway inflammation. 2. Mnemonic for treatment. CAMP. Control medications. Long-term control. Inhaled corticosteroids, ICS. First-line therapy to reduce airway inflammation. Long-acting beta-2 agonists, LABAs, used in combination with ICS for long-term control. Leukotriene receptor antagonists, LTRAs, can be used in combination with ICS or as an alternative therapy. Combination inhalers, ICS plus LABA combinations, for example, fluticasone salmeterol, budesonide formoterol. Acute medications, relievers, or quick relief. Short-acting beta-2 agonists, SABAs, provide quick relief of bronchospasm, for example, albuterol. Oral corticosteroids, used for short-term control of severe exacerbations. Management and monitoring. Asthma action plan, personalized plan for how to manage symptoms and exacerbations. Regular follow-up with a healthcare provider. Prevention of exacerbations, avoid triggers, use of controller medications consistently. 3. Other treatments. Biologics, for severe uncontrolled asthma, for example, omalizumab, mepolizumab. Allergen immunotherapy, allergy shots to desensitize individuals to specific allergens. Patient education and self-management. V. Potential complications of asthma. 1. Mnemonic. Rest. Respiratory failure, severe exacerbations that can lead to respiratory failure and a need for mechanical ventilation. Exacerbations, frequent or severe asthma attacks that can cause significant morbidity. A status asthmaticus, severe life-threatening asthma attack that does not respond to initial treatment. Thickened airways. Chronic inflammation can cause airway remodeling and reduce effectiveness of treatment. 2. Other potential complications. 3. Pneumonia. 4. Chronic airway obstruction and reduced pulmonary function. 5. Anxiety, depression, simplified explanation. 1. Airway inflammation. The airways become inflamed and sensitive. 2. Airway constriction triggers cause the airways to narrow, bronchoconstriction, and mucus production. 3. Breathing difficulties, wheezing, coughing, and shortness of breath result. 4. Reversible obstruction. Treatment with bronchodilators or anti-inflammatory medications reverses the obstruction. 5. Airway remodeling. Over time, chronic inflammation can lead to structural changes in the airways that are irreversible. Professor Hammer's advice for learning asthma. 1. Understand the airway inflammation, that chronic inflammation is the root cause. 2. Know the symptoms. Wheezing, coughing, and shortness of breath are hallmark signs. 3. Identify triggers. Understanding triggers helps prevent exacerbations. 4. Know the treatment approach. Reliever and controller medications are critical for management. 5. Be aware of complications. Severe asthma attacks can be life-threatening. In summary, asthma is a chronic inflammatory condition of the airways, leading to reversible airflow obstruction, bronchial hyperresponsiveness, and airway remodeling. Recognizing the symptoms, understanding the pathophysiology, implementing an appropriate treatment plan that includes controller and reliever medications, and identifying triggers are all vital for managing asthma effectively and improving the patient's quality of life.